Identify barriers with the use and application of technology and develop interventions to remove the barriers. Hirsch 2014 states that nurse leaders are not fully devoted to the idea of implementing health information technology in the workforce. This leads them to a great disadvantage. Hirsch 2014 also references the use of EHR documentation as an example, which involves using a computer, but unfortunately, not everyone in healthcare has gone completely computerized with their documentation. Barriers mentioned were that nurses still prefer to use memory recording of data with the intention of documenting the data at a later time. The lack of comfort, competence, and/or confidence in using electronic documentation, few working devices, or just few devices in general to support the bedside documentation, the awkward placement of bedside devices, and ineffective documentation templates and/or content. Karajan, Hunt, and Huneker, 2019, wrote a research article about care managers who use multiple HITs to coordinate their care for chronically ill patients in the hospital and outpatient settings. Barriers that they identified were technology related, such as access to information, inadequate information, limited usefulness and usability of the technologies, challenges associated with using multiple HITs, and technical problems. They also mentioned that the strategies to these barriers are to adapt to work routines, such as creating user-friendly education materials, obtaining assistance from other care managers or IT support, and getting the organization involved in fixing the problem.